Hello and welcome to the Introduction to ATSDR and the Public Health Assessment Process, also called the PHA Process Webinar. This is part of ATSDR's PHA Webinar Training Series. The content covered in this webinar is based on the first 3 modules from ATSDR's online PHA training. This webinar is sponsored by the Agency for Toxic Substances and Disease Registry, called ATSDR. For reference, you can find the presentation slides that I'll be using and the recording of this webinar on ATSDR's website. The files are available in accessible format for people with disabilities. My name is Greg Zaris. I'm an atmospheric scientist, geophysicist, and civil engineer by training. I've been with ATSDR for 27 years, and I am the director of the agency's Office of Innovation and Analytics. Prior to coming to ATSDR, I was with the U.S. Environmental Protection Agency, EPA. Sylvia Allen Lewis will be joining me for this webinar. I'll let her introduce herself.
Hello, everyone. I'm Sylvia Allen Lewis, and I'm a health education specialist with ATSDR. I've been with the agency for about 24 years. Before I came to ATSDR, I was an education specialist at the Department of Defense, where I was involved with community engagement and education projects. I look forward to this webinar, where I will share some things about ATSDR, its products, and experiences working with communities.
Let's go over the online PHA training modules, or FAT modules. These will serve as a topic for this webinar. FAT Module 1 introduces the PHA process and how ATSDR uses the process to address the mandates of our agency. The next topic we will cover is the material from FAT Module 2, which details the steps of the PHA process and how ATSDR works with communities affected by contamination at hazardous waste sites. And then finally, we'll talk about FAT Module 3, which explains how ATSDR gathers the data needed to perform the PHA process. This slide presents the webinar objectives. The 3 things we want you to take away from this webinar are: learn why and how ATSDR performs the PHA process. Identify the ways to involve and work with communities throughout the PHA process. And learn how to obtain and document site data and information needed for the PHA process, as well as how to handle data gaps. We will start now by talking about the FAT Module 1. This module includes 3 sections. Section 1, about ATSDR. Section 2, the components of the PHA process. Section 3, working with EPA. Congress established ATSDR in 1980 under the Comprehensive Environmental Response Compensation and Liability Act, or CERCLA. This mandate, which is also known as the Superfund Law. This law was set up to identify and clean up the nation's hazardous waste sites. CERCLA requires ATSDR to evaluate the presence and nature of the health hazards at site-specific hazardous waste sites. To best achieve this, we work together and coordinate with EPA. Later, I will explain the different roles that ATSDR and EPA have while working together at hazardous waste sites. ATSDR is also mandated by the Resource Conservation and Recovery Act amendments of 1984, known as RCRA. RCRA authorizes ATSDR to conduct public health assessments at hazardous waste sites, storage, or destruction facilities. It also authorizes ATSDR to assist EPA in determining which substances should be regulated and the levels at which the substances may pose a threat to human health. Finally, the Superfund Amendments and Reauthorization Act, or SARA Act of 1986 extended ATSDR's responsibilities regarding PHAs and led to the establishment and maintenance of toxicological databases, dissemination of information, and medical education. Based on these mandates, ATSDR's mission is to protect communities from harmful health effects related to exposure to natural and man-made hazardous substances, respond to environmental health emergencies, investigate emerging environmental health threats, conduct research on the health impacts of hazardous waste sites, and to build capacities and provide guidance to state, tribal, and local health agencies. Let's talk about ATSDR's PHA process, which involves various steps to examine hazardous waste sites. Examples of these steps include examining possible health effects, responding to community concerns, and identifying actions to protect public health. ATSDR uses its PHA process to directly address CERCLA, RCRA, and SARA mandates, as we mentioned. I recommend you refer to ATSDR's Public Health Assessment Guidance Manual, called FAGM, for more detailed information. You can find the FAGM at ATSDR's website. Now let's talk about the PHA process components. The figure to the right shows the components, which include triggers, data and information, scientific evaluations, products, and outcomes. The triggers are how ATSDR becomes involved at a site. The PHA process is triggered when an individual, a community group, or other parties submit a petition to ATSDR to investigate a specific site or facility. When a site is proposed to the listed National Priorities List site, that's another trigger. Or when another federal, state, or local agency or tribal department asks ATSDR for a technical assistance. So this slide has us going through each component needed when a petition letter is the trigger. For this example, we will say that the data needed include measurements from a spill at a wood company. The scientific evaluation includes examining possible exposures to the site contaminants following ATSDR's 4 main scientific evaluation components that are part of the PHA process. These 4 components of the scientific evaluation include the exposure pathway evaluation, screening analysis, exposure point concentrations, and exposure calculations, and in-depth toxicological effect analysis. Our products help us answer some of the public health questions or problems associated with hazardous waste sites. A couple of products could be a response letter or a report such as a PHA. The outcomes for our example include follow-up actions based on ATSDR's recommendations. At the end of the PHA process, we develop a report that includes various types of information collected during the PHA process. The PHA process can result in different written products to document the findings, which include a PHA, a health consultation, a letter health consultation, an exposure investigation health consultation, a health advisory, and a technical assist. Each of these products has a unique purpose. A PHA typically takes longer because we look at complex sites that warrant having a full health assessment. It documents the results of ATSDR's evaluation of all the available information about a site and the potentially affected communities. It addresses various exposure situations and or the community health concerns and may address multiple contaminant, multiple pathways of exposure, or a single exposure pathway. Most Superfund sites need a full health assessment. We will talk about a complex site like this later in this webinar. A health consultation generally focuses on one public health issue or question, one contaminant or one health condition, or a technical interpretation. Health consultations can range from brief letters to full reports. A letter health consultation responds to specific health issue or question. A health consultation also does, but this letter provides a much more focused response. This is sent in the form of a letter to a specific requester, such as an environmental agency. An exposure investigation health consultation, if deemed necessary, assesses possible impacts to the public when a complete environmental or biological data are lacking for that site. This can be a follow-up to an ATSDR document or conducted as an initial investigation. A health advisory alerts the public and officials to a public health threat. We may issue this type of product if imminent health hazards are identified at a site during the PHA process. A technical assist is a written response where we provide technical or educational information to help a requester make an informed decision. Other products I want to mention here are fact sheets. We have a variety of fact sheets on different topics. You can see our fact sheets and other publications that we have developed online at https://www.atsdr.cdc.gov/publications.html. As I mentioned, ATSDR collaborates with EPA throughout the PHA process. This table compares the ATSDR and the EPA environmental site roles, but I should acknowledge that this is an oversimplification. If you read the real Superfund law, it goes into specifics on what ATSDR is supposed to do and what EPA is supposed to do. And when you look at the two sides of the table, I have to mention that I'm a child of the 60s and 70s. And during those times, there was large environmental movements throughout the country, which started mainly due to the use of chlorinated pesticides, including Agent Orange that was used during the Vietnam War. Later, we found that dioxin was part of the Agent Orange mixture. In 1970s, in an area of Missouri, there were two companies at the same production building. One made Agent Orange, and the other used dioxin-containing trichlorophenol to make a chemical called hexachlorophene. And as part of this process, these manufacturers had reservoirs of leftover waste in the production plant. And they were mostly at the bottom, which they sedimented out to the bottom of these reservoirs. And the oil reservoir contained dioxin. At this time, a man who owned a waste oil removal company was hired to clean up the bottoms of the reservoirs. The man was not advised that the reservoirs he cleaned out contained or were contaminated with dioxin. Back then, oil waste was often used as a dust suppression, so he did so. And in applying a dioxin-containing oil residue, first to his mom's church, some stables, and some areas throughout Missouri. Commonly, this area was known as Times Beach. Later, that area became flooded and dioxin went everywhere. And many of the animals were dying. Investigators studied the chemical containing contamination, and there was something in there that was really deadly, but they couldn't detect it yet. This was another environmental contamination accident led to the development of CERCLA, which was written as a congressional mandate to remove or clean up abandoned or inactive hazardous waste sites and to provide federal assistance to toxic emergencies. And it created specific parts of the law for ATSDR to investigate these and other types of contaminant releases. And I'm just going to touch base on these topics throughout this webinar. So in addition to time speech that we just talked about, I want to mention some other really important historic sites. One is Valley of the Drums in Kentucky, where there were storage drums containing waste as far as the eye can see. The other site is Love Canal. Love Canal was the first vapor intrusion site, but we didn't call it back then. So now let's talk about this summary table, which separates our role from EPA's when we both come to a Superfund site and have to evaluate it together. We evaluate the potential community health effects from waste sites or toxic releases. We determine the possible health effects from past, present, and future exposures, where EPA uses similar risk assessment tools to determine the cleanup levels for the site. We recommend the needed actions to safeguard the community's health, and often EPA takes our recommended actions and then they regulate and monitor sites and enforce laws. We work to help communities and other stakeholders minimize either exposures and effects from environmental contaminants, where EPA's role is performing cleanup to reduce those exposures. Both agencies interact with communities. So that's the end of our discussion for FAT Module 1. Now I'm going to turn things over to Sylvia, who will go into greater detail about the PHA process and how ATSDR works with the communities at sites.
Thanks, Greg. Welcome to the part of our webinar where we will go over the concepts covered in the online FAT Module 2. The goal is to reinforce the importance of placing the community at the center of our environmental health response. We will talk about the steps of the PHA process, how we work as a disciplinary team, multidisciplinary team, and how we engage the community throughout our PHA process. This slide shows the steps in the PHA process. They include initiate site scoping, define roles and responsibilities, establish communication mechanisms, develop a site strategy, including a site conceptual model, collect site information, select sampling data, conduct scientific evaluations, which include evaluations of exposure pathways, screening, exposure point concentrations, exposure calculations, and in-depth toxicological effects. And the last step is to summarize findings and our next steps. I want to emphasize that the community is involved throughout the entire PHA process. When we're out in the community, we should be encouraging people to join in ATSDR activities. We should be listening so that we can better address the community's health concerns. And we should give people in the community the tools and the information they need to participate in our activities. All of us who work at sites using the PHA process know that it's a very fluid situation because every site is different. Some sites may be a little bit more complex and require more investigative activities or more community actions, while other sites may not require as many activities. ATSDR works in teams to facilitate the PHA process. So as a site team member, you are part of a multidisciplinary team that goes out into the community. A couple of years ago, a health educator in our cooperative agreement program shared a quote with me that I'd like to share with you. I thought it was really appropriate. She said, "It's the beauty and vulnerability of public health that makes it, by its very nature, multidisciplinary. I thought that quote tied in well with how ATSDR works in teams. The basic team is made up of health assessors, health communication specialists, health educators, community involvement specialists, and our regional representatives. Our site team members can also include other folks, such as subject matter experts or SMEs. Example of some SMEs might be epidemiologist, hydrogeologist, toxicologist, or vapor intrusion specialist. The team members will depend on the needs of each individual site. As we work in teams, we also rely heavily on EPA. We also work with internal and external groups such as tribal governments, local, state, and other federal agencies. Now, we talked about the steps of the PHA process and how we conduct our work as a team. Now I'm going to talk about working with the community throughout the PHA process. We'll only hit the highlights today. The Engaging the Community webinar will cover this topic in depth. The community is very important in our work. Not only is it a source of information, but community members are the primary audience and recipients of our products. Community engagement at hazardous waste sites gives the community the opportunity to become involved in the decision-making processes that will affect them. We provide the information they need to address environmental health issues in their community. To me, the PHA process is not a process if we don't listen to the community and actively work to invite them to have a seat at the table and really be our partners. Throughout the entire PHA process, the community is a key participant and an important resource in our work. Community members can provide information that will improve the quality of our products. This exchange with the community is a two-way street. You learn information from the community, but they learn things from you too. Some of the things that they can learn from us are what the PHA process is all about, how they can become involved in the process, how our PHA process can help address their health concerns, and what are the conclusions we reach and why we reach them. Okay, now I'll talk through the 4 steps to engage the community in our PHA process. These steps include get to know the community, communicate effectively, tailor outreach and community activities, and work with community leaders and organizations. Let's talk about the community engagement step. Get to know the community. For the PHA, we gather as much information as we can about the community. We start this process early before we even go out to a site. We develop a community profile that shows community characteristics like demographic trends, the culture in the community, the social network the community has set up, the political structure, and so on. You should also get information about their perceptions of risk and the different types of nonprofit agencies and community leaders and other stakeholders in the community. Now, all of this information is considered secondary data that you can get from the internet or other credible national databases. You can get this type of content from internal documents from other agencies. You can also get this information from geographic information systems or GIS maps and data from ATSDR's Geospatial Research Analysis and Services Program, or GRASP. GIS maps can help us identify populations near the site. They can help us identify site boundaries, other pollution sources, population density, and demographics over time. GIS maps are also really good at helping us pinpoint at-risk populations. Thus, the community profile helps the team make decisions such as whether environmental public health activities are needed at the site. It also helps us to determine outreach and educational activities that would work best for the community. The second step is to communicate effectively in your writing and speaking. It's important to use all the information that you've gathered in your community profile as you begin to communicate with the community and develop a communication plan. The communication plan will be your guide in designing and conducting outreach and educational activities. Now let's talk about the things that can help you with your communication planning. One of the things you want to do is to review the site and community background information and define and identify the potential communication challenges you may face. When you begin to work with the community, it's important to develop communication objectives. Think about what you want to say to the community about what you're doing at the site. You need to formulate your key messages and talking points. And putting all of this work up front will allow you to engage the community throughout all the stages of the PHA. Now, the third step is to tailor your outreach and community activities. Information about outreach and community activities should also be in your community plan, as I mentioned earlier. Based on all the information you've gathered about the community, you're going to be able to make decisions about what's the best meeting format to use, such as one-on-one meetings, public meetings, or work group sessions. You're going to be able to choose the most appropriate type of communication materials to develop, such as fact sheets, newsletters, and posters. You're going to be able to make some decisions about how to handle the media. Some sites we work at don't have media attention at all, but then other sites have lots of attention. So you need to come up with a plan to know how you will work with the media, as well as what communication channels you will use to reach the community, such as emails, letters, telephone calls, or social media. And the fourth step is to work with community leaders and organizations. In order for the PHA process to work effectively, the site team must listen to and understand the community and its health concerns. As I mentioned earlier, the community profile is a way to get to know the community before you even go out to the site. One way to get community health concerns is by having a meeting while you're out there at the site and you talk to the community. It's important to talk to different segments of the community. You want to build trust, maintain partnerships, and keep open two-way communications with various community contacts. For instance, talk to healthcare providers, elected officials, religious leaders, staff at university and other academic institutions. You talk to local environmental groups, business leaders, and other local community leaders. Find out what their ideas are and how they feel about what's happening in their community. It is important when we talk to and interview community members that we listen for the information that they think is important. You need to listen to what they believe, what their perceptions are about what's going on. You need to keep open the lines of communication about what languages they may need to have information communicated to them. And you need to keep abreast of the community and its culture. This information, when you pair it with all the other information that you have from the community profile, will have a big impact on how you're going to work with the community as you develop your PHA products. At ATSDR, we've got lots of ways to meet with the community to gather their health concerns. We want to engage them in the PHA process. We want to keep them updated about what's going on in their community, and we want to announce any major investigation milestones. Now let's talk about some ways we meet with the community. We're typically conducting community meetings using public availability sessions, public meetings, or a mixed community format. Public availability sessions are where community members can drop by in an informal way and chat one-on-one with ATSDR and other agency staff. We can also do a big formal public meeting with ATSDR, EPA, the region, and the community to talk about what's going on, our activities, and how we're all going to work together. And then we can also do a mixed format where we combine aspects of the public availability session and a public meeting. Based on our prior research about the community, we would choose the information and the format that we think will work best to deliver our health communication messages. I want to share a little story about a community meeting that links back to how each community is different and how you have to tailor your communication to a specific audience. I had a site where I thought I was doing all the right steps. I did the profile, the team checked this, we checked that. We talked to community leaders about conducting a site visit, and we wanted to know who would be best to host the meeting. We talked to several other leaders, and we talked to the petitioner, and they told us that they thought the community would like. From that information, we decided as a team to meet with very small groups of people, no more than 15. And these smaller groups would allow us to go through and interact with the community in a very personal way. This small group setting would give them the opportunity to share how they felt about what was going on at the site and how they wanted us to work with them. Well, the team spent a whole week sending out postcards to community members and setting up all these little information sessions and breakout sessions. And we got the confirmation cards back from different community members. And so the team is thinking, wow, we got this. We're all set. Everything is going to be fine. Well, I think you know where I'm going with this. It's just that it didn't turn out like we planned. And our plan was that we would do a short group talk with everybody. And then we would say to the group, okay, now we're ready for you to go to your breakout sessions. And then we're going to talk a little bit more about what we're going to do at the site and get your opinions as to what you'd like for us to do. Well, like I said, it just didn't turn out that way. No one would move from the general session. They didn't want to go anywhere. From that experience, it seemed that the community members took comfort in being together and sharing their stories. And although it seemed that we had buy-in to conduct the meetings in that very small group format, once that community got together and all of them knew each other very well and felt comfortable, they didn't want to be separated. And so at this site, I learned two important things. One of the things I learned is that you have to listen to the community and be flexible about how they want to receive the information. It doesn't matter if we were all ready to conduct our small group meetings and we had all of these handouts and all that kind of stuff. They wanted to be together as a group to share their stories. That was important to them. And then the other thing that I learned is even though it didn't work out the way we planned, the way the team planned, don't be afraid to try different and innovative types of techniques in an effort to find out the concerns of community members and how they want to work with us and what they want to know. So this slide has a lot of resources to guide you as you design and implement your own community engagement and health education activities. These include the following: ATSDR Community Engagement Playbook 2021, CDC ATSDR Principles of Community Engagement, ATSDR's Engaging the Community section of FAGM, the Precede Proceed Model for Health Program Planning and Evaluation, the International Association of Public Participation, IAP2, Spectrum of Public Participation, ATSDR's Communication Toolkit, NCEH ATSDR's Clear Writing Hub. The information in these resources is very helpful as they identify the theories that are behind engaging communities and helping you conduct successful environmental health activities at sites.
Thank you, Sylvia. Those are really good resources, by the way. So now, moving on. If you took the online training, You would have seen that the FAT Module 3 is divided into 3 sections. These include the importance of obtaining site information, the steps to obtain the site information, and the data needed for the PHA process. I'm going to combine these and include some of these in the case scenarios while I'm talking about the steps. So let's talk about the importance of obtaining site information. Yes, it's important to know what to do, the job, the steps to obtain it, and the data needed for the PHA process. It's important because it sets up your understanding of what's on the site, the location of the site, and the site history. Site information also helps you evaluate the nature and the extent of the site-related contamination. When you become familiar with the site, it helps you lay a foundation for developing a conceptual model for understanding the potential exposures. The information you collect will also help you draw public health conclusions, respond to community concerns, and make appropriate recommendations to prevent harmful exposures. There are several steps in the iterative process to obtain site information, and this slide just lists some of them. I'm going to talk about just a few. One is to get the basic understanding of the site, and you want to do some research up front before you go and visit the site. Another good way to learn about the site and surrounding area is to have the GRASP folks help you prepare an introductory map. We'll take a closer look at that on the next slide. Also, if you obtain site information, you should involve people like Sylvia and other SMEs to help you identify things you might want to look for and strategies for communicating with community members during your site visit. And then when you come back, you'll want to identify data gaps and determine whether or not there are any gaps and that you could that might prevent you from making public health decisions. Unfortunately, most assessors aren't able to visit the site over and over again, but you will return to the site in your mind when you re-examine the notes that you take while you're there. So something very important to do early on, as Sylvia mentioned, is to reach out to the GRASP folks. They are the GIS experts. GRASP stands for Geospatial Research, Analysis, and Services Program. You can reach out to the GRASP through an email at placeandhealth@cdc.gov. ATSDR partners should contact their technical project officers for GRASP services. The first thing to ask when you talk to GRASP is to get them to develop an introductory site map, like the image shown to the right. It provides a general profile of the site and the demographics of the population within 1 mile. GRASP can also include different community points of interest that you might want to visit when you go to the site. This will give you an overview of the site before you visit the site and a good idea of the composition of the community to help inform you of your activities when you get there. For example, later when you go to the site, you can find out that a highway cuts right down through town. And so that there's no possibility that the people that live on the other side of the highway, away from a giant fence, can really come to contact with the contaminants that are on the site. Then you can look at the map and really refocus on who is potentially exposed and who the what parts of the community might have access to that site. After you've gained a general understanding of the site, you will determine the data needed and pinpoint the relevant data sources to tap into. You will want to review the site-related documents, consider anecdotal information about exposures, site history, previous property use, community concerns, and so on. Identify and contact potential information sources and establish information networks to obtain additional information. Now let's practice identifying site information by looking at the Gala Lumber Company, or GLC, case study. You're so lucky to have this petitioner because Mr. Frank John really outlined a lot of the problems on the site. This is not always the case for us. Usually we get many more health effects expressed and very little information about the site. So Mr. Frank John did give you a lot of data. In his letter, Mr. John expressed his concerns about homes on private water over TCE, contaminated groundwater plume. TCE is short for trichloroethylene. TCE in the well water, potential vapor intrusion, most likely from the TCE, and health problems such as headaches, nausea, and dizziness. We will now talk about some planning tips for the site visit. As shown on this slide, consider the following tips to help you prepare for the site visit. Identify data needs, plan your communication, coordinate the details of the site visit, including the schedule. Involve the community and promote meetings and your meeting messages. If you'd like more information after this webinar on these tips, I suggest you refer to the FAT Online Module 3. We just talked about preparing for the site visit. After your preparation, you will tour the site. During the site tour, you will obtain firsthand site information to help support your assessment and health effects evaluation. Respond to the community's questions and health concerns. Identify the data gaps and complete the PHA process. Be sure to conduct the site tour before you meet with the community. This will help you get prepared and be able to address the community's site-related concerns. This photograph is of Meredith Wood Treatment Site located in East Point, Georgia. This is one of the many wood treatment sites that ATSDR has worked on. Wood treatment sites are one of our top kinds of facilities that we have had Superfund sites on. For this site, I visited the Meredith Wood Treatment Facility after I looked at all the data and after I looked at the site history over time. There were some important things that you don't find when you're just looking at the site history. For instance, when I went to visit a site, I saw what looks like to be beautiful trees, and you can see it here, in the park on the right side of the lumber facility. I came to find out later, however, that the other area is a Superfund site called Payne, which also treated wood. So you think about all the bad stuff present at a Superfund, an old Superfund wood treatment facility. And this one was only cleaned up to industrial standards, not residential standards. So you might discover things like this around your sites and say to yourself, wow, but this place is accessible and it still needs to be fenced. So these are the kinds of things that you examine when you're looking at the site. You can find other health hazards that you might want to consider because they are environmental health hazards too, and it could harm the community. Also, when looking back at this site, I see in the foreground that there is a very narrow chain link fence with gaps about a foot in between the single wires that chain across. This tells me the site is somewhat accessible. And we see these very dark logs that are loaded very close to us, very close to the street. I'm standing by the community. Actually, the community is to my back. And as we go off into the distance, we see lighter brown wood. If you look in some locations, you might see greenish color. Then we see the facility in the background. This is the retort facility where they pressure treat the lumber. And then further in the background, we see apartments. These happen to be a senior assisted living complex. Now let's look at more photos for the Meredith site. The first photo is a picture of the main Meredith site. The photo on the right is a zoomed in photo of the senior assisted living facility. As we are on our site visit, we see there is a community around. We find out a little bit about how the people have their water delivered to them. We also find out from the city that some people use their unregistered wells for irrigation or other non-potable uses. So these are important things to know and to find out when you're visiting the site. Okay, after the site visit, and after you visit many other wood treating facility sites, you say, let's put this into one of those kind of wood treatment categories. And so here is an overgeneralization of three main chemical processes. There is the pentachlorophenol process, sometimes called the penta process, which releases pentachlorophenol and trichlorophenol. If we think back to the Times Beach story, the issues that were started with the pentachlorophenol and that they were contaminated with dioxin. And depending on how old the site is, you can find different levels of dioxin. Then there is the creosote process. Creosote is associated with darker black logs. It used to come from a creosote bush, but things are different now. The photo on the slide shows a low building with stacked browner looking logs in front. And then finally, we have the heavy metal process, which involves a variety of pollutants, but it involves arsenic, copper, and chromium in varying amounts depending on the kinds of wood and the dates of the treatment process. The wood from this process results in greener looking logs. And then there is another process that uses boric acid. This is a modern process. So these are the kinds of things that you might expect to find depending on the age of the site and the chemical processes used at the site. Now, so this is a dioxin timeline. Let's use this dioxin timeline to look at the data and the uses of penta wood treatment. Through the 1960s, there was a series of worker studies that investigated the presence of dioxin and other chlorinated substances in the wood treatment process. And then later in the 1980s, there was a series of log home studies published based on investigations done mostly from 1978 through 1980. As a result of these studies, EPA regulated pentachlorophenol so it had less dioxins. Other laws followed. In 1992, the wood treating facilities had to stop using methylene chloride. Then there was a series of community studies from 2003 through 2007, some of which we at ATSDR were involved with. Following these studies in 2007, EPA outlined certain limits for managing aspects of the wood treatment process. Now, I want to go back to our discussion on the CERCLA mandate. And it's part about improving the science. So we, you included, are playing a role in improving the science, which helps EPA to create new laws. In other words, we are not only investigating the site, but we're also trying to improve the sites and to make the industry safer for communities. This next slide is about the site pathways we found in Meredith. We found that soil contamination remained on the site. We learned that the city water is not initially impacted. However, the water used from the water supply wells for watering the yards might have been. And we met with the community, as Sylvia mentioned, and this was very helpful in getting inside information and to help develop our exposure scenarios. This is a very important step. And from speaking with the community, we learned that they smelled chemicals in the air and when. It is very important to carefully compile and organize the data that you collect. Checklists like this image on this site, the site information checklist, can be very helpful. Both the online training and the FAGM toolbox have checklists to help you through the various parts of the PHA process. So you should definitely take a look at these. You can go to your site and use the site information checklist to track what's important, such as all those different ways in which people might come into contact with site contaminants. After you complete your site report, you will, after you complete the site visit, you will prepare a report. And we want a site report so that you can go back to reference it and see what you've learned from the site. For instance, when you're assessing a possible exposure pathway, you might want to return back to see the facts or even see photographs from that are germane to that pathway. Another tool to compile and organize your data is by using a site summary table. We will go into that in just a bit. So let's now talk about the GLC site. Because of what the petitioner, Mr. John, wrote in his letter, we should investigate if there's the potential for a vapor intrusion issue. You're going to learn more about this, but I want to point to two things on the slide. One part is that the former rule of thumb was to screen data within 100 feet laterally. Farther is a good idea, especially if there are potential preferential pathways, such as sewer lines or surface cover, such as paving that might cause further soil gas migration, or if there's an uncertain plume delineation. And the other part is to look for all these types of data that are associated with vapor intrusion, as shown on the vapor intrusion image on this slide, which include indoor air, outdoor air, crawl space air, sub-slab soil gas, exterior shallower soil gas, and near surface source soil gas and groundwater. All these are important pieces of data in assessing this pathway. As I mentioned, it often helps us to use checklists that are developed by ATSDR. While evaluating soil vapor intrusion may seem very complicated, a checklist will help you. You can find ATSDR's soil vapor intrusion guidance on the FAGM resource page, which has a checklist, this checklist shown on this slide in Appendix A. The checklist even has a box for wood treating process, as shown here under 1B. So this can help you build your conceptual model of exposures at this site. So we need to critically review the site documentation and involve the SMEs during this process. And during this process, you will review all the information identified during the site visits, such as community health concerns, risk perceptions, and environmental contamination, possible exposure pathways, and individuals that might be affected by exposures to contaminants and the possible health effects. Based on this and the information you've reviewed, you will need to identify whether there are any data gaps that could impact the results of the PHA process. You will determine recommendations to address and to fill these data gaps. For instance, you may suggest additional sampling to be conducted. As soon as you identify the data gaps, share them with your SMEs and colleagues at agencies that can help fill the missing information. At this point, we should ask ourselves, do we need more data to evaluate exposures? to quantify the number of data gaps we have found over the years, we did a little evaluation some years ago. We looked at our health assessments between 2007 and 2012 and found that there was 575 recommendations that asked for more data in order to do a proper health assessment. The recommendations included such things as exposure point monitoring, biota data, and continued monitoring of ongoing exposures. Luckily, 83% of those recommendations were adopted by our partners, usually by EPA. And then we got the data to complete the health assessment. Other times, we had to collect the data ourselves, and we'll talk about that later. So let's build our conceptual model by doing an exercise with an example of a site summary table. I want to mention some things while we're here for this exercise. So study this GLC site map. It's shown here on this slide, and pay attention to the location of the operable units, often called OUs. If you take the class online, you'll see this map of the GLC site and the 3 OUs. This is often how EPA and other federal partners divide up the site to help clean up one area at a time. The map shows you that the GLC site, it shows the site area, its boundaries, the roads and the features and the buildings, and the 3 OUs. The map also shows the flow of the Haynes Creek watershed, and it flows from east to west across the GLC site. And you'll see that the GLC site area is fenced. The GLC on-site area is divided into 4 quadrants, which are northeast, southeast, southwest, and northwest. We'll discuss each of these in clockwise order. We're going to move clockwise around the site now. The first northeast quadrant consists of OU1. It includes the former trichloroethylene contamination spill area, marked here as TCE, along with 3 on-site buildings marked as brown rectangles. The spill area and the buildings are less than 200 feet from each other. OU1 is bordered to the east by an off-site park and playground area, 800 feet from OU1. It is also bordered by 9 off-site homes beyond the fence about 400 feet north of OU1. We take note that the TCE spill has occurred on this site. This is not typical of most wood treatment facilities, but here it is. Most sites have some surprises, and TCE is a very common chemical found at many sites that ATSDR evaluates. So this slide is included here to show you an example of a site that was named Chicago Heights. And there was a very well-defined, well-established plume in this area. And EPA was going to take remediation measures to prevent sub-slab soil gas from entering into the homes in this very focused area. And we asked them to go a little bit further outside because in this case, it was shallow water. And sure enough, they did it and found a little hit. And then we asked them to go a little bit further and they found some more. And lo and behold, they went 600 feet away from the shallow groundwater plume, and there was very clearly vapor intrusion. So on this slide, these little triangles refer to sub-slab measurements, and the little stars refer to the indoor air. And sometimes it's really hard to get into someone's home because they need to be there and let you in. And so getting sub-slab air is sometimes a pretty good surrogate to indicate that a pathway exists. Now, it's not to collect a good measurement to establish risk, but it does let you know that a pathway exists. So as we continue clockwise back at the GLC site, we'll now look at the map in the southeast quadrant. The southeast quadrant shows a cluster of 5 on-site buildings. There are also 5 homes beyond the fence, 200 feet from one of the buildings. And the map shows that GLC's waste impoundments, they're about 400 feet west of the cluster of the buildings. And the waste impoundments are part of OU2. In addition, there are 5 homes beyond the fence, about 400 feet south of the waste impoundments. The waste impoundments contain most of the GLC's operational waste, which is it's important to know because as well as the locations of the community road. So we will focus now on the southwest quadrant, where the map shows an uncovered drip pad where GLC placed chromated copper arsenate, or CCA, treated lumber for many years. The Sunshine Daycare Center is located next to a portion of the former on-site drip pad area. It's less than 200 feet away. We see the drip pad is very close to the fence line, and as it was in my case with the Meredith situation. But now, current day, thankfully, the new law restricts you from having an impervious drip pads of concrete to put the logs on rather than soil. And it was not the case in the past. And in our case here, the daycare center, that is what you're going to be evaluating. Moving on, we have the map for the northwest quadrant, where the GLC's OU3 is located. OU3 consists of the on-site permitted dump area where polychlorinated biphenyl wastes were deposited for many years, labeled as PCB on the map. There are 5 off-site homes beyond the fence located 400 to 600 feet to the north of the PCB dump area. There are also 9 off-site homes beyond the fence at about 600 feet west of the PCB dump. As with TCE, we have PCB waste materials here, which is also not typical for wood treatment facilities. So using information you've collected, we want you to develop a site summary table like this example here for OU1 from the online training session. This example includes columns for site area, site description, and waste disposal history, investigations and environmental monitoring results, corrective activities and current status, and exposure conditions. There's also an example of site summary table in the FAGM toolbox. You can copy these example tables and use them for templates to develop your own when you go and do your site visit. These are very helpful. The PHA process can be very long, and the document comes at the end of the process. But you want to make sure that any immediate site-related health hazards are addressed early on, not at the end of the process. Once you've gathered and reviewed and organized your site information and data, you must identify site priorities to ensure any immediate site-related hazard is addressed. I recall a site at Kerr-McGee. Kerr-McGee site was also a wood treatment site in Mississippi, where we immediately could see that there were physical hazards when we went to the site. I saw a very harmful situation where people could have had access and that we addressed it early on instead of waiting for the report to come out as much as a year later. This graphic here shows the types of data needed for the PHA process, which include site background information, environmental chemical data, exposure pathway information, contaminant-specific information, community health concerns, and health outcome data. Now, let's look at just a few of these types of data. This diagram shows what we need. What we need environmental chemical data for the PHA process, why we need that. As previously mentioned, ATSDR usually depends on EPA and other agencies, such as state and environmental and health agencies, to generate and provide the environmental chemical data necessary to conduct the PHA process. In addition, site owners are a common data source. So let's pause now with a question on what 6 chemicals should we consider from what you've learned from the GLC exposure scenarios. So what were you thinking of? Some answers I've seen before are arsenic, benzene, CCA, chromium, copper, dioxin, metals, naphthalene, PCBs, TCE, vinyl chloride, and volatile organic compounds, also called VOCs. And I would mention that I like the vinyl chloride answer particularly because it shows that someone is even thinking down the line of the degradation products from the TCE. This side here includes examples of data by media. If you recall, when I showed you the vapor intrusion slide, when you look at air associated with vapor intrusion, there were many types of samples and different kinds of media that were represented that represent the air pathway. The same goes for the food chain as well as for soil and groundwater data. There are different ways of collecting soil gas, for example, to represent what people might be exposed to. Other examples include physical hazards and surface water. So let's look at examples of chemical information needed for the PHA process, such as on-site and off-site sampling data, location of samples, contaminant concentrations, sampling dates, sample and analysis methods, field measurements, and quality assurance and quality control of the data. All of these are important. I'm just going to touch on sampling data because we have vapor intrusion issues at this site. So some sites also have radon. Radon is a gas which moves just like other vapor intrusion chemicals. What's great about radon is it's easily measured. So here we're able to monitor radon because it's very detectable and instruments are available for real-time data. If we need a radon expert at our sites, we can call an ATSDR SME to help us. These graphs show how radon measurements for an example of a basement over various time periods. This includes a 48-hour, a week, a month, and a year. Here we can see how the radon measurements are periodic, and we can calculate time-weighted averages. But there are times that radon is much higher and other times than the other times. So I'm getting soil gas and indoor air data related to vapor intrusion, and we might want to make sure that in the vapor, as with measuring for TCE, that we have measurements that capture these periods where it could be higher or low. Also, when we're looking at the vapor intrusion data, we want to know if subsurface measurements of the vapor and indoor air were collected in a synchronous way. The reason to find this out is if I know what's underneath your house and then I know what's getting in, I can then determine how well your house is suited for preventing your exposures. And that's an important piece of information. So again, reach out to an SME for assistance. Let's look again at the data needed for the pH process. Look at this diagram, now getting more into the contaminant-specific information component. While evaluating contaminants at the site, you should study their physical, toxicological, biologic, and physiological properties. This information will support your exposure pathway and the health effects analysis. ATSDR's toxicological profiles are at our go-to resource for contaminant-specific information. You can access those at www.atsdr.cdc.gov/toxprofiledocs/index.html. In addition, we have many resources and guidance on specific contaminants that can be found in FAGM. And we're happy, and we have many SMEs on staff to help you interpret this contaminant-specific information and help address contaminant-specific issues. The last data needed in the PHA process that we're going to be talking about is here. It's shown on the diagram on this slide, and it's health outcome data, or we call it HOD. ATSDR is required to look into whether HOD are available at sites. Based on the specific criteria discussed in the online training module of Module 7 and in the FAGM, ATSDR determines if a health outcome data analysis should be conducted. HOD will not prove cause and effect, but may indicate the need for more focused environmental or health data. I want to mention that we don't always have good health outcome data, and there are especially not good ones that are site specific, but sometimes we do. And I highly recommend consulting with epidemiologists throughout the PHA process when you're using these data. For health outcome data, the best way we often can get it is by zip code data. And we ask our state registries to provide this for us with the zip code information. We usually compare those data to the sister zip codes around the area and around the area of interest. And hopefully they are comparable, and especially when we look at statewide comparisons. In this case, I'm showing you that on the screen, we found an increase in certain kinds of cancers next to one of the creosote wood treating facilities. This image of passage from the PHA shows how we reported on that finding. The circle around the elevations were observed in the incidence of cancers. Again, it's really hard message to give back to the community because it doesn't necessarily represent their exposures. But it's important to include in your document some of this information when it is available to help give a full report card of the exposures. Now, I'd like to summarize what we've talked about today. We discussed how the PHA process helps us meet the CERCLA, SARA, and RCRA mandates. Visiting sites helps us understand our conceptual model of the possible exposure to contaminants in the environment around that site, and community involvement helps us address environmental public health issues and communicate with residents near the site. And early involvement of SMEs is key to help us resolve data gaps. And that's the end of our presentation. Thank you for interest in this topic.